Good morning, Wabash. Man, that feels good to say. This week speaking at chapel is Dr. Patrick Burton. Dr. Burton grew up in Buffalo, New York, and then attended Williams College in Massachusetts, where he received a degree in biology. Soon after, he completed his PhD work at Boston University before taking a postdoctoral research position at the University of Maryland. Giving his talk titled Depression, It's Okay to Ask for Help, Dr. Patrick Burton.
Good morning, Wabash. I'd like to thank you for the opportunity to speak here today. I must admit, I accepted my invitation with a bit of trepidation, having never before given a chapel talk in my decade at Wabash. For those of you who know me, I tend to be a man of few words. I like to get straight to the point. Depression affects 14.8 million Americans ages 18 and over, which is 6.7% of the population, or if you prefer, 1 in 15 Americans. Depression is the cause for 2/3 of suicides in the United States, and suicide is the 10th leading cause of death in the U.S. and the second leading cause of death from ages 15 to 24. So I hope you can understand why I've chosen this particular topic today. Despite these facts, only about half of Americans suffering depression seek treatment. Why is this? I believe that the main reason is because of the social stigma surrounding depression. This stigma keeps those who suffer from it from not only seeking help, but even talking about it. I know, because this same stigma kept me from talking about it for what is now years. In fact, before making that statement, I could count on two hands the number of people that I'd spoken to about my own depression. So with some hesitancy, I've decided to tell you my story of depression. I tell you this story not for sympathy, but in the hope that in telling it, I might be able to remove a small bit of that stigma, at least here at Wabash. I also hope that in hearing my story, those of you who are lucky enough to not suffer from depression will understand why it is so important to talk about it. And for those of you who have or do suffer from depression, I hope you will feel a little less alone. In the evening of Wednesday, February 20th, 2012, I was watching the dress rehearsal of the Wabash production of the play Take Me Out with my EQ class. I had dined at the fine establishment known as Little Mexico for dinner, chicken fajitas. In the middle of the production, I began to feel intense stomach cramps, or at least what I thought were stomach cramps. I had felt this pain before in recent days, but this was far more intense. In fact, it was everything I could do to not vomit then and there. I managed to sit through the whole production, though, and on my way home, the pain began to dissipate, and I thought little of it at the time. Unfortunately, that was not the end of this pain. I began waking up in the early morning hours with this same pain. It was at that point I mentioned to my then pregnant wife, Ellen, that something was wrong. We ended up in the hospital, and it became clear I had gallstones and my gallbladder would need to be removed immediately. I was prepped for surgery, said goodbye to a body part I'd never actually seen, and that was that. Or so I thought. Now, I suspect a number of you are familiar with this type of surgery. It is fairly routine as surgeries go, and I had no reason to expect anything other than a full and quick recovery. Yet this was not the case. Within a week, I was back in the ER with the exact same pain. Each time, yes, I went to the ER multiple times, I was diagnosed with something that made little sense to me and failed to explain why I was suffering the exact same pain. I even had an MRI, which I was told was negative. At this point, I was convinced, despite the MRI, that something was quite wrong with the ducts that connect my now missing gallbladder to my small intestine. Sometimes it's handy to have a PhD in biology. I needed someone to take a closer look, a much closer look. I needed an endoscopy to look right in there. It turns out that IU is one of the best places in the world to have such procedures, and so I called to make an appointment. Luckily, at that time, my wife worked with the dean of the medical school, who was able to get me in to see a physician named Lee McHenry within 2 weeks, instead of the 3 months I was told when I called on my own. Dr. McHenry is an amicable fellow, and one of those physicians that immediately strikes you as someone who really knows his shit. He took one look at my negative MRI and told me I've got a stone lodged in one of my ducts. I also had swelling in my sphincter of Oddi. What the hell is that, you might ask? It's the sphincter muscle that connects the liver, pancreas, and gallbladder to the small intestine. So it is an important little muscle. I was booked for an endoscopy the next day. The endoscopy went well, or so we believed, but I failed to recover properly, though, and was kept in the hospital for overnight observation. The next day, Dr. McHenry took a quick look at me and immediately scheduled another emergency endoscopy for that morning. My sphincter of Oddi had swollen shut, preventing the enzymes from my liver from getting into my small intestine. This can cause them to back up into the pancreas, and trust me when I say that is not a good thing. After this emergency endoscopy was performed, I was given a clean bill of health and headed home, where I developed a chronic pain on my side at the approximate location of the surgeries. 3 months later, I received another endoscopy, this time to place a stent in my duct, 2 stents actually. 3 months after that, the stents were removed, yet the pain has never really gone away. I used to count the consecutive number of days I was in pain, but I lost track somewhere around 400. All of this is true and unembellished, but the point of telling you so far is to explain how it is that depression can come about. I read an interesting study that my psychologist pointed me towards. In the study, rats were divided into 2 groups. The first group was challenged to run a maze to receive food at the end. If the rats took the wrong path, they were given a punishment with an electric shock. As you might guess, those rats got damn good at running that maze. The second group of rats was challenged by the same maze, but was randomly shocked regardless of whether or not they correctly ran the maze. The rats in the latter group developed depression. I know what you're thinking. How can you tell if a rat is depressed? I don't know. Okay, actually, I do know. They stopped eating and started losing their fur. Poor little rats. Anyways, I realized that I was the rat. I felt like I was being randomly punished. Do you know that less than 1% of people who have gallbladder surgery have complications, and less than 0.1% of those people have complications requiring a procedure beyond a single endoscopy? Approximately 700,000 Americans have their gallbladders removed each year. If you're doing the math, that puts me in the company of about 70 people. That's a small number considering the nearly 320 million people that live in the US. But the math isn't relevant here, except for how it made me feel. A random statistic in an unfair world. During this time, Ellen began suggesting I find someone to talk to. I felt she was fairly subtle about it, no doubt being careful not to push too hard. I didn't realize it at the time, but I had withdrawn from my life quite a bit. Our typical lively dinner conversations had all but ceased. I avoided spending time with my son whenever possible, especially without my wife to help me. The things that usually brought me pleasure in life, spending time with my family, working on my various collections, even a nice glass of wine seemed more like a chore than anything. In short, nothing in life really gave me any pleasure at all. I looked forward only to bed because it meant that another day was over. Things spiraled slowly but steadily downhill from there. I continued to withdraw from the world. When forced to be part of it, I was moody and irritable. I began falling asleep at unusual times in the day. Sometimes I would cry for no apparent reason. Still, I didn't realize that anything was wrong with me. I would later learn that family and friends noticed the changes, but they were afraid to say anything. Only my wife broached the subject, and she remained cautious. I hit rock bottom when I began crying myself to sleep most nights. Suicide seemed like a more and more reasonable alternative. I craved darkness and solitude. I even called a suicide hotline one night when things got really bad. 2 things kept me going during this period. The first was my family. I knew somewhere deep inside myself that my wife and son needed me. I knew I couldn't give up. I wouldn't. The second was my job here at Wabash. I love teaching here. I love interacting with my friends and especially my students. Through much of this, I had continued teaching, trying to not let any of this affect my work. I knew I have something to offer students, and as a professor at Wabash, I feel as though I have a contract with each student in my class. Students give 100% effort in their classes, knowing that 100% isn't always the same. Students have rough patches too. In return, I give 100% back. I do everything I can to prepare students for what comes after Wabash. In my darkest hours, this perspective gave me purpose. a reason to get out of bed, a reason to keep fighting. Sometime during this stage, I finally realized something was wrong. My wife became insistent I seek help, and I finally heard her. I sought help first through my general practitioner, John Roberts, and ultimately through both a psychologist and a psychiatrist. My psychiatrist is an interesting man. He's not exactly someone I like very much, but I am quite confident in his experience, which is what's important. It took several different medications and dosage changes and a considerable amount of stress, anxiety, and depressive episodes, but over the course of a year or so, we eventually found a combination that works well for me. This is a point that I'd like to emphasize for those of you who might experience depression. My psychiatrist was able to provide some help right away, but it took months of tweaking to get the right combination to really get things under control. A psychiatrist is an important tool, even crucial avenue of help, but they aren't magic. It will take time to find the proper balance. Paul, my psychologist, is also an interesting man, but in a different way. He's not exactly the most friendly or bubbling, natured person that I expected. Not that that expectation was fair. I didn't even know him. It's fair to say, though, that I found it difficult to click with him. This wasn't helped by the fact that I wasn't really sure why I was in his office. Of course, it was because of the depression and my acknowledgement that I needed help. Yet I wasn't really sure how he could help me. I didn't really need someone to simply listen to me. I'm not generally the most open of people, and the thought of telling this stranger my inner thoughts really wasn't very appealing. After a couple of sessions with Paul, it became apparent to me that if he was going to help me, I needed to play a larger role in figuring out how. This approach proved to be a turning point in our relationship. I asked him how he could help me. What was it he could offer beyond simply being someone to listen? It was at this point he told me about cognitive behavior therapy. The goal is to train yourself to stop unhealthy thinking and actions. The idea is to replace errors in thinking with a more mindful, open, and positive thought. For example, when I was depressed, I felt that everything was against me and that things would never get better. I felt that I was alone and no one could help me. Through experience and training, I taught myself to correctly believe that depressive episodes will be short-lived, that the world is not against me, and that there are people who can help me. Paul helped me to do this. He also pointed out that some behaviors reinforce the depression. When depressed, Ellen would spend more time comforting me and watching over me. I liked this attention and began to crave it. Thus, the more depressed I was, the more I was rewarded with attention from my wife. Once I understood this, we had to work together to stop this cycle by first offering more attention at random times when I felt fine, and also to stop offering comfort when I was depressed. This was difficult for both of us, but it really did help. To put a happy spin on this fairly depressing story, pun intended, I will tell you that I am much improved. I still struggle with depression, and it might be that I always will. Still, with training and medication, I've found a good balance. Depressive episodes are less and less frequent. Equally importantly, the episodes are far less severe and are short in duration. Ellen tells me I've returned to my old self. I enjoy spending time with my family again. I have a great relationship with both my wife and my son. As is obvious, I continue to teach here at Wabash, and I continue to love doing so. In fact, I hope to do so until the day I retire. So why did I tell you this story? Well, for a few reasons. First, for those of you who've never experienced depression, and I truly hope that is the majority of you, I wanted you to know how dangerous depression can be. You need to be vigilant for your roommates, for your friends, and your brothers. If you see signs of depression, urge them to seek help. Make sure they understand that you are there to help them. Make sure they hear you. Second, for those of you who suffer from depression, or may in the future, I wanted to provide you with something to relate to. Know that you are not alone. If you need someone to talk to, I strongly recommend our counseling center. Kevin and Jamie are located right downstairs, and they are always available by appointment. You can call or email them at any time. Their contact information is easily found in the directory. Or if you prefer, my door is always open. For the depressed, I wanted you to know that what you might expect in seeking help. Therapists aren't simply people to listen to your problems. They can offer strategies, such as cognitive behavior therapy, yet it takes commitment and an active role in therapy to achieve true changes in destructive thought processes. I also wanted you to know that in many cases, medication can help you, but that it takes time to get the dosage and the specific medications correct. Third, as I now look back on my life, I recognize that the long depressive episode I have described to you today was not my first. I have had other episodes over my life. The first being when I was a student athlete in college. I was a swimmer, and I was a pretty good one, but I became injured with tendonitis in my shoulder and was unable to swim. Thus, I became depressed, and it became important for me to go home in the middle of the semester. You may find that this kind of depression is episodic, but that doesn't make it any less severe. Did you know that only half of all Americans who suffer from depression actually seek help? This number is far too low, especially when you consider that the age bracket that includes you, 15 to 24. Those that seek treatment are successfully treated in greater than 80% of cases. There is help out there. It's okay to ask for it. After this, I'm off to grab lunch at the Scarlet Inn. If you want to talk, feel free to join me. Thank you, Wabash.